Welcome to our March Early Stage Researchers Working Group, everyone. We're really excited to have Seng Chan You. Dr. Seng Chan You is a medical director who specialized in internal medicine at Severance Hospital in Korea, and he earned his Master of Medical Science degree from the same institution. Then in 2016, Dr. Yu began studying at the Department of Biomedical Informatics at OHDSI University as a military scientist officer to fulfill his mandatory military service in a research-related capacity. During his time at OHDSI University, Dr. Yu joined the OHDSI community and conducted research within the network. And then in 2017, he received the Best Community Contribution Award for Clinical Evidence Generation at the OHDSI Symposium. His research continued to gain recognition, and in 2021, he was awarded the Young Scientist Award of Wunsch Medical Award for his international study investigating the comparative effectiveness and safety of ticagrelor versus versus clopidogrel across the OHDSI network. And after receiving his PhD from OHDSI University, he started working at his alma mater, Yonsei University. His contributions to the fields of biomedical informatics and clinical research have really established him as a leading young scientist in his field, and we're so excited that he is joining us today for this career speaker event. So thank you so much, Chan.
Yeah, thanks so much to introduce me and inviting me in this meeting.
Yeah, absolutely. I think so many of us admire the work that you've been doing in the APAC community, and we'd love to hear about your career journey. So maybe we can start with how you first decided that you wanted to be a physician scientist, and what was that, what led you to this career path?
So it's really tricky, I think, because I thought that, so in Korea, we have 2 years for pre-med and 4 years for in the medical college. And after the medical college, we have a 1-year internship and 4-year residential programs. And I did a residential program for internal medicine. After this, every man in Korea has to serve in military, and I decided to serve in military as a scientist, which for those in engineering and medicine can serve the military service as a scientist. So that's why I decided to do my medical service, military service at the OHDSI University as a PhD candidate. And so in 2016, I started my PhD at the OHDSI University, which is the first university who joined the OHDSI community. And at that university, I joined the OHDSI community. After that, after the 5 years of PhD course, and then I just decided to remain as a scientist rather than physician. So that's how I became a physician scientist, which I've never thought about it, because after the residency program, that I thought that I will be a kind of the physician and the cardiologist. So, but after joining OHDSI, and I think that that's really interesting and really great. And I was really happy to be involved in this community, and we can generate evidence, and we really want to generate reliable evidence across the community, across the international society. So the things that OHDSI is one of the main thing that which led me to the scientist rather than physician.
Yeah, it's really interesting that you started out in the military and not necessarily doing within a medical profession, but you were doing science within that, and that sort of cemented your interest in pursuing this as a path. So what are you working on now? Like, what is your current what are your current activities and research?
So yeah, because as a professor at the university, I need to do some education and research together. And for my research, I usually do some OHDSI observational study in terms of the population level estimation or patient level prediction or characterization, whichever. And then I'm also involved in some studies related with the artificial intelligence, especially for the reliance of the artificial intelligence or reproducibility of artificial intelligence in the medical field. In those fields I'm working on now. And yeah, I do some work for the kind of the digital healthcare because as a with my proficiency in the clinical field and the digital field. So I'm doing some work for the hospitals too.
So Paul just mentioned that you've led over 10 network studies in OHDSI. I had no idea. What has that experience been like?
So once again, that I'm the kind of the I don't think that I'm a kind of the person who are really international. But Odyssey has 6 values which include community beneficence, innovation, collaboration, openness, and reproducibility. So I think that Odyssey is kind of the open, collaborative community. And when I first joined in Odyssey in 2016, I felt that this community is really welcoming people, because even though I'm not good at English and I'm not good at, it's my barely first time to meet some international people across the world. So, but I feel that the warmness from the peoples across the community, and even though I'm not really good at, research or coding and English, so that led me to, to the current position.
And so it seems you also lead the medical imaging working group. Can you talk about
Together
let's talk about that. So what is the working group doing, and what has that been like, and kind of are there any current projects that are exciting you?
So I'd like to integrate many other, unstructured data into AMOP CDM, because the AMOP CDM actually synthesize the very core clinical data, but we need more data, including, text, geographic information, or medical images data. And that's why I proposed radiological data imaging data model previously. And Paul actually caught me that, and then we started the medical imaging workgroup together, and given the Paul's suggestion that we need to capture the provenance and the features from the medical images, and we need to build some infrastructure for reproducible and operate more reliable medical imaging study across the artist network. That's why we started a medical imaging workgroup. And since we have Paul, I'd like to hear from Paul for this too.
No, you're not getting off the hook. This talk is not about me. This talk is about you.
Yeah, I know that, but for the medical imaging worker, you can say something for this.
Yeah, I've had so much fun working with Chan. It's so important. I am a physicist. I really like working with physicians. It's great it's an important dyad that I've talked about before that I really like. Chan has done incredible foundational work with the radiology CDM. I encourage people to take a look at it. He really has pioneered efforts for bringing imaging acquisition parameters, and imaging features into building machine learning along with OHDSI. This is incredibly important for the future of OHDSI, so it is really a pleasure to work with him on doing that. And together, we're in a race. We have a friendly competition, and I stress friendly to see whether his hospital or my hospital will be the first to actually implement imaging phenotypes within our health systems. Our personal goal is that we actually do a network study this year between our two institutions, maybe one other, where we do imaging federated deep learning along with outcomes data derived from OHDSI. So it's a complete pleasure.
Yeah, once again, I think my hospital will be the first.
I wish you well.
Thank you.
So, hi, Chan, it's nice to see you again. So I had a question. So I think thinking about this idea of adding imaging data into the OMOP CDM, I think a lot of people, when they are sort of in like the early stages of their career, they're thinking, you know, what are these projects that I want to focus on? What is going to be really important to me? What is going to be like my thing and my main contribution? So I'd like to ask a little bit, could you talk about your experience in how you came up with this idea for adding images into the OMOP CDM, where you get the sort of the source of the creativity that you have in how you apply this to your research? I think that's, you know, it's a really important skill. So if you could talk a little about that and how you develop that, I think that would be really interesting to the members of the group.
So yeah, thanks for asking. And then first of all, I need to start with the more previous one, the work of mine, which is the genomic CDM. So I proposed the genomic CDM, and now we do have the genomic vocabulary for this. And I think that because I'm a kind of a stupid person, and then I do not know much things about the genomic genomic data science. So that's why I just started genomic CDM work. So because as a physician, I am usually taking up view of physician. You know, physicians usually do not know about the data science, and they really want just some simple, data structure. So that's why I propose a genomic CDM, because most physicians need the genome variant rather than really complex the raw data of genomic analysis. That's why that's how I just started to propose the genomic CDM, and it is really similar that because I'm not the specialist of the radiologist, so just from the view of the physician, I'm thinking about what kind of the information the physicians need, and what kind of the data elements that data scientists of them or medical scientists want to know. That's how I started. And together with Paul, we are building the more complex medical imaging common data model. And in this data model, we are capturing the features and provenance from the images. Moreover, I think that most fundamental thing will be that we are building the infrastructure for reliable and reproducible, medical AI system for the radiology or medical images. So, once we standardize the metadata and the relevant features or provenance of the medical images, then we can, easily reproduce the medical AI algorithms across the institutions, and we can, because we are capturing the provenance and the features from the of the algorithms across the institutions, that we are easily to reproduce the results or performance of the AI algorithm across the institutions. That's our purpose of this work. And if Paul, do you have any thoughts on this or additional thoughts? Please add.
Oh, yeah, sure. I think this is incredibly important. I just think that, yeah, so right now imaging is standing alone, and most of it doesn't have good outcomes because they have great progression and phenotypes on disease. And OHDSI has incredible outcomes data. And so we're really excited about combining the two together. We've been working on this for over a year, and we are very close to our reference implementations and our drafts. And so I feel like we've really done a lot of hard work. We've brought in some of the really the best ontologists in our field, in the fields of radiology and imaging informatics. And we've really done a nice job as a new working group, just going around and seeing what everything is out there. So it really kind of starts with a literature review and inviting people in. And so we're really excited about the model and how we've generated it. And our fingers are crossed that the CDM group will approve of our imaging extension. We tried to make it as practical and as OHDSI-like as possible, only introducing 2 tables. But this will be a big year for demonstrating that. I put a link to some of the really impressive work that Chan has done on machine learning from genomics and for medical imaging, combining that with OHDSI. He's really been able to publish a tremendous amount. And I guess the question I have for Chan is, how old were you in your Google profile for your Google Scholar profile? Because you look to me like you were probably in high school when you had that photo taken.
Yeah, it was yeah, just the photo. I took that photo just right after the graduation of university, so it was kind of 20 years ago. I know, 10 years. Yeah, it was 10 years ago. Yeah, a decade ago.
You've already had such an incredible career within the last 10 years. It's really impressive to see your publication rate and your citation rate, even over the last 3 years, has really taken off.
I think I'm really proud.
Would you say OHDSI has helped you with your academic career path?
Yeah, of course. Yeah, it was really helpful. I published really privileged journals, and by conducting the network studies across the OHDSI, and one of my publication includes JAMA, and Nature Communications and Hypertension. Those are really privileged journals, and I've really I have an experience to publish it in Lancet or the JAMA Internal Medicine as a co-authors with Mark Schuchard or George Rifsack. It was really a great experience to have as a researcher.
Yeah, and Chan, you mentioned a few times that one really key mission or value in OHDSI is collaboration, and I'd love to hear how you think that, because something that I really admire about OHDSI is how it's a global network and we have collaborators all across the world. And since you focus really heavily on the APAC community, how do you think that we can sort of collectively improve collaboration across the world between the APAC community, but also collaborators on the West, to make sure that we are addressing like all real world needs and working to address like key solutions.
Before answering to your question about the collaboration between APAC and the global community, I'd like to address that what we are doing during the COVID-19 pandemic. And I want to say that the Korean actually we in the Korea we introduced the first the Asian-wide database for the COVID-19 patients from the HERA to the OHDSI, because in 2020 we actually had the OHDSI Europe symposium at Oxford. We plan to have the community activity at Oxford at March of 2020, and at the time we've got the COVID-19. And since China and Korea was the first 2 countries to have COVID-19 patients across the world, we've converted the nationwide database into the amount of CDM and to provide some, to chance to the global researchers to investigate the many many studies for the COVID-19. So that's how we contribute to the world. But across the APAC regions, and recently I'm heavily working on the APAC community of OHDSI. And since many countries in APAC actually do not have that, I do think that unfortunately Asia countries are not really familiar with each other, just like the European countries. The East Asian countries, include China, Korea, and Japan, and we do not like each other as a country. I really want like the persons in those countries, but usually the countries do not like each other's. So, but we are trying to overcome these challenges across the APEC countries, and then we are trying to raise more researchers from the APEC regions. So I started a study called Chapter, which is the study for characterization of the disease or these patterns across the before and after the COVID-19 seasons. And I want to invite more researchers from the APAC regions for this country, and to raise them as a kind of the OHDSI researcher. And we are trying to raise the more researchers, and I think that we need more support from global community, because we do have the English language barrier, and we do have more time zone gaps between Europe or United States. So that's why it is hard to collaborate with other regions such as Europe or America. So yeah, I think that even though APEC is trying to expand our community across the APEC regions, but we need more support from the global community.
Yeah, I personally really admire all the foundational work that comes out of the APAC community, and I wish I could be more involved. So I'm definitely going to try to. But yeah, it's really great, and I think it's always exciting to be able to collectively work with people from other countries. So I look forward to seeing your vision come true.
And please note that Asia is the continent that the most people actually live in the world.
Yeah, and I know Paul just mentioned in the chat that there's more data partners in Korea per population than any other country.
Yeah, that's right. I'm so proud of that.
Mm-hmm. So I know another thing that you've mentioned is that you definitely hope to see more scientists or physician scientists, and early stage researchers potentially pursuing that route. So can you maybe talk about some of the work that you're doing at Yonsei University to try to implement that?
Yeah, please let me share my screen for this.
Absolutely.
Yeah, so yeah, I want to address more detailed description for the support for physician scientists at Yonsei University College of Medicine from Korea. And we need more doctors who are scientists in many fields, and in OHDSI too. And because I'm a doctor at OHDSI, which makes me a little bit unique in this community. So, because in Korea, for the med school, we do have several parts of the careers. So from the undergraduate to the assistant professor, or the kind of the career at the university. So we have really various supporting system for medical scientists at each stage. So for those who are at undergraduate, we are we're maintaining the medical scientist training program for the undergraduate course, and then after graduation of med school, and they become to resident doctor at the hospitals. And for those who are at the residential training session of the hospital, we support the MD PhD or medical scientist training program, which are funded by the national governments. And for those who are at the postgraduate program, there is a physician scientist training program too, with the grant. And not all of them actually enter to the career at the university as a professor. So we do have some kind of a bridging career as a translational assistant professor at the college, and we have some programs for those who are professors at the college as a medical scientist research career development program. So we do have really holistic approaches and support for the medical scientist in the university. And especially for the data scientists, we do have many coursework, mentorship, hackathon, or workshops to train them, train and educating them about the AI or data scientists. And we'd like to, there are so many mentorship programs to drive them to the researcher rather than just the physicians. So we do have a coursework for data scientists for all pre-med students. And we conducted we have several workshops for such as the digital healthcare bootcamp with Yonsei, and then we had some hackathons, and we had ECG challenges in the previous year, and we have more challenges in this year too. So that's how we try to raise more vision scientists in this university and in this country. And I'd like to bring more vision scientists into Odyssey too.
That's really, really cool. And I'm excited for that to happen. On one of those slides, you mentioned that the MSTP program helps or involves like one-on-one mentorship and helping students with finding mentors. And I'm curious to know, were there any mentors in your life who you feel were important in helping you identify that this was one of your career interests?
Yeah, indeed, because when I was a med school student, I did some research at the many labs, and then I found that I found that I'm not fitting I did not fit in the many labs, especially for bio labs or wet lab. I'm not good at doing some pipetting or something. So that's why I just trying to move to the data science rather than pipetting. So that's one of the mentorship works. They found that you are fitting this work or not, and then and the other thing is that they let me do some research, and they let you lead you some to some work for the actual research. So it's really different that from the just reading the papers rather than and then there is real difference between just reading the paper and conducting extra research. And during the mentorship, nowadays we are trying to make the students to write papers as a first author and conducting them research. So that was really helpful, and we published more papers after years and years.
Yeah, and you're also including some data science coursework.
Yeah, of course.
What kind of skills do you think, whether that's coding or something else, what kind of skills did you do you think are very important for early stage researchers to kind of think about developing, or that maybe you wish you had learned before you joined OHDSI?
Yeah, I'd like to recommend to follow the OHDSI's recommendation because, our society is, pursuing the reproducible and reliable evidence generation. So, and we do have really many foundations for this. So we are sticking to GitHub, and and there are so many good policies for the for using how to using OHDSI GitHub. And you can learn many things from this policy, and you can learn many things by reviewing others' coding or others the tracks or comments of the GitHubs of others. And then there are you may not understand why the Atlas does not support something, or the OHDSI tools ecosystem does not support something, but because we are trying to provide the best practice infrastructure, research infrastructure. That's why something is not supported, and by understanding why of the OHDSI's tool ecosystems and infrastructure, then it allows you to become a more better scientist. Yeah, rather than just coding skills.
I think you summed that up really nicely, I guess, and I know that this is also something that Paul is quite into, is this idea of like peer-to-peer learning. So learning from looking through someone's projects or someone's work, or going through someone's GitHub and seeing why they've made certain choices and how they've made certain choices. I think it's a really nice way of sort of, one, furthering this idea of a community, and then also two, upskilling and educating yourself. And actually, I really like the way that you discussed how we build certain things within OHDSI. So it's opinionated, and I know that so Hadley Wickham, who I guess a lot of people in the OHDSI community will be a big fan of, when he talks about the tidyverse, and particularly I think ggplot, he says, we will give you a lot of flexibility to do things, but we will make it easy for you to do the things that we think you should do them, or in the way that you think you should do them. And I think that's a really nice lesson that has been pretty well received and understood within OHDSI, of we will provide you with the tooling to do what you want, but what we will do is we will make your life as easy as possible to do the right thing, or to do what we think is the right thing, and then to back that up with studies and data and analysis to say, this is why we're making these design choices within our studies. So I think what you were saying there was very impactful. Indeed. I think that's sort of something. No, go ahead.
Yeah, so I'd like to recommend that if you are interested in the machine learning, medical machine learning, then you need to add some modules to the patient level prediction, and then you will learn the best practice of the medical machine learning, according to the tripod guideline, or the recommended guideline for the artificial intelligence.
Yeah, I think that's certainly the way that I learned when I first started. Was the first thing I got tasked to do within the PLP working group was just to add smooth calibration curves. But in order to do that, you then have to understand how the package works, understand how the results objects works, and then you have to figure out how to add something in. And what I found really helpful was like identifying a mentor to help me. So at the time that would have been Jenna Reps, who co-leads the PLP working group. I don't know if you had someone similar like that. So when you first joined the OHDSI community, was there someone who then took that step to say, hey, look, here's a problem, you can probably figure it out, but you're going to have to figure it out? I don't know, did you have a similar experience like that?
Yeah, because at the time, because it was the kind of the beginning of OHDSI, so we'd have Martin and Jenna or Peter for the PLP or PLE works, and then because the most ecosystem are not so mature like now, so that's actually because I joined early. I joined the OHDSI at the earlier stages, so that's why I learned a lot and I can understand the current ecosystem, tool ecosystem of OHDSI. It was really great experience of mine. And please use forum of OHDSI, or please use the GitHub issues if you have any questions or if you need any helps. And then we are here for you. Yeah, I'd like to say that for the early researchers at OHDSI.
Yeah, definitely. I definitely would echo those. So we have so Paul mentioned in the chat, but it would be great if you could tell us a bit about your vision, and then take your physician hat. As a physician, how do you think OHDSI will impact clinical care in generally, and then also specifically in cardiology? I don't know if you probably have a vision on this, so it'd be great if you could tell us a little bit about this.
Yeah, so I previously wrote editorial about the evidence-based medicine and about this paradigm. So in OHDSI, we are trying to generate reliable evidence by using the observation research framework. And then, until now, the most physicians or researchers in the clinical field does not believe the the reliance of the observation evidence, observation research. But here we are trying to generate the reliable evidence by using observation research, and we are trying to use our best practice, and we are trying to build the infrastructure for this. And for the cardiology, recently more and more trials actually need more patients, and eventually we cannot increase the enough patients for the clinical trials for the innovative cardiovascular methods or device or drugs. And then I believe that the observation studies provide timely reliable evidence for the many diverse ethnic groups in timely manner. Most evidences are actually built for the Western people, I believe, and then Asian people has really unique features. And then I need my previous study comparing ticagrelor versus clopidogrel across the Korea and the United States. I found that we think even though ticagrelor the previous trial, which conducted a decade ago, proved the efficacy of the newer drug, ticagrelor, but my study found that there is no difference between the ticagrelor and clopidogrel in terms of the effectiveness or safety. And actually, the ticagrelor increased the bleeding risk without the benefit of ischemic events. And this study was published in JAMA, and it was really striking that because we do have the results from the really big, large RCTs, even though it was a decade ago. So like this, we need to more timely evidence, and we need evidence for more diverse ethnic groups, and the evidence for the routine clinical practice, which is an real world evidence. So that's the vision of OHDSI, I believe. And for the machine learning, I think that OHDSI provide the fundamental infrastructure for reliability of artificial intelligence, which has been really challenged in these years. So that's the vision of mine for OHDSI.
Yeah, I think that you make a really fascinating point there about how we see this heterogeneity in effectiveness and safety of efficacy and safety of drugs, looking at different global populations. And I think this is something that for myself, I always see this heterogeneity as sort of like an opportunity. So it's more work to understand it, but then once you actually get this understanding of it, it gives you a much better idea of, okay, so how can we personalize treatment for patients? How can we move from this idea of like this one size fits all form of medicine and into something that's more personalized? And I think something that I really would love to see is sort of a lot of this research that does a lot of observational research, but then maybe what you do is you look at how does, say, like an Asian population with an Asian background living in Europe or in the US, how does that compare to an Asian population that is living in Asia? How do these things combine? Do we have some idea of what these genetic traits are, or certain specific things about living in a country? I think I know I find the idea of really investigating this heterogeneity sort of super exciting. But one thing I was like, yeah, so a follow-up question. So you talk about, you've taken this research that's been done in the US and you've run a sort of a comparative experiment at your home institution, in your home environment, and you saw the differences are there. Do you then have any projects that are going at your department or within your hospital where you say, okay, we want to take what has previously been seen as sort of like the gold standard of care, but we need to adapt this based on the evidence that we've generated? So do you have any projects, or do you have any ideas about how you would like to take that information and put it into action?
So investigate for the study of my previous study comparing ticagrelor and clopidogrel. At the time, the guideline recommends ticagrelor over clopidogrel for the patient with acute coronary syndrome because of the based on the previous evidence from the randomized clinical trial. And then I found that it might not true, and because there is substantial heterogeneity in that study across the regions. That's why it was, admitted. It was regarded as a good evidence for the privileged journal. And then we are trying to, demonstrate the previous knowledge or previous evidence at this, current contemporary medical practice, and then across the regions or across institutions in the OHDSI network. And we are trying to rebuild the paradigm of the evidence-based medicine. And then recent study I'm doing is that I'd like to I investigate the effect of ranitidine at the cancer risk, because the ranitidine is was expected because of the carcinogen of ranitidine. We do not use ranitidine anymore, but I want to see that whether it is really related with cancer development, and then because of the prevalence of each use, that if it was related with the cancer incidence, then we need to screen patients with ranitidine use for the cancer development. So that's the study I'm doing, and we are looking for the results published in the journals, and we need those evidence.
So I think in the last 10 to 12 minutes, I'd love to open the floor to other people if they want to unmute and ask questions. We can make it like a Q&A.
I've got a question. How would an institution go about replicating some of your work with the use of like radiographic data in the CDM? I'm at Dell Medical School at University of Texas at Austin, and we are just starting our implementation process. We've got a lot of young researchers, though, who a lot of medical students who are hoping to use the CDM to start research even while they're still in their education. And a lot of them have expressed interest in image data. How can we follow your work?
Yeah, that's really great questions, and I want to pull to answer to these questions. I need to go somewhere since there is some alarm from in my home.
Okay.
I'm sorry.
All right. We will wait with bated breath.
And so, Andrew, I certainly would recommend you joining our working group. We meet every 2 weeks. We in our work group, we have the data model for the extension of OMOP. Do you have a base OMOP model at Dell Medical School, or what associated health systems are you tied to?
We are, well, okay, your second question first. We are associated with a group of clinics that we operate with medical school, UT Health Austin. We are currently using the Athena EHR, and we are in the process of implementing or standing up the CDM based on that data.
Absolutely.
What was your second question?
No, that's great. So you are working on omopifying your Athena EHR, and
Yes,
that's
sir.
great. Once you have that, and do you have a VNA or PACS infrastructure associated with Athena?
I don't know. What do you mean by that?
So medical images are also considered medical legal records. So there's going to be an enterprise archive. They're held separately than the EHR. Your Athena is the EHR, but your radiology and cardiology will send the actual images to what we call a PACS manager or a picture archiving communication system.
Yes, I've encountered this on the back end. Yes, I don't know. We recognize that that's a problem for us to get a hold of. We kind of deprioritized it, but it is on the roadmap for like phase 2, you could say.
Yeah, and so those images would then often go to an archive called a vendor neutral archive, which would be a big DICOM bit bucket. And that's the ideal place for you to capture metadata about images, for you to then de-identify them and to use them for research and training purposes.
Okay. Okay, great. Thanks. That's a good insight.
Any other questions for me? Yeah, I'm back. Thanks for waiting. Yeah, if not, we can.
So, John, I think the question was, how would someone best go about replicating some of your studies if they have, let's say, a motivated team of students?
So yeah, for my studies,
less replicating studies and more how could we kind of achieve what y'all have achieved with the inclusion of image data into the CDM and make it available for research? But I think I've got my answer to that.
Yeah. So yeah, but we invite you to the medical imaging work group because we are building the infrastructure for the medical imaging together.
And Andrew, I think it actually opens up a lot of really interesting opportunities, especially for medical education. So if you think of anatomy classes, a lot of anatomy classes are beginning to bring in CT data and MR data as part of teaching anatomy with radiological correlation. I just think this is actually a great place to actually, to bring in disease with OMOP, to bring in case conferences for help people to ask questions of the data. And so sometimes, it's really helpful when you have your own clinical data that you can use, but for training purposes, that's not entirely necessary. You can work with other partners or work with some of our larger synthetic data sources like the SynPuff database.
Yes, we've been working with our medical students, and we have encouraged them to go ahead and to start using the different tools, especially Atlas, to get their cohort creation skills in place. And we've let them know, you don't have to wait for us to get our data fixed. You can write a script against the CDM and publish it for it to be executed against somebody else's instance. And I guess that's the second question. How can students who are new and have really no reputation as a researcher, how can they get the cooperation of other OMOP collaborative institutions to execute their queries against their data? Has that been difficult? Have you found that to be very difficult?
Andrew, you have come to the right place.
Yeah.
Okay, good. I thought I was.
Because again that in 2016 I had no reputation, and then my English was worse than now, and then but I've got the collaborators for my studies. And then, so please promote your studies and at the OHDSI calls, and the forums to let many people know about your studies. And then, there are so many venues to publish your data, especially the GitHub of OHDSI studies or OHDSI. So I want you to say that to promote your studies across the OHDSI network, and we are here to help you and to support you. If it is really, if you are want to generate reliable evidence.
Mhm. Okay, great. That
Yeah,
sounds
it's
good.
also worthwhile mention that is actually the mission of this working group, is to provide mentoring and education for undergraduate, graduate, medical student, junior faculty, senior faculty, anyone who there's a lot to learn in OHDSI, statisticians. So there's just so this is actually a place where we help try to gather and build training ladders and help connect them with other resources and mentoring within the OHDSI community. I would love to mention that at Johns Hopkins, we actually were able to create an elective week for our medical students to help them learn OHDSI. And so that takes that takes a lot of work, as you know. And so, be happy to share with you the syllabus and the curriculum and the experience that we've created with it. We kind of split the week between OHDSI and digital health. So one is going to be creating evidence, the other one's going to be implementing evidence. But basically, and so the problem, so we compete with other electives for that week, but we do often get like about 40 medical students a year who choose to go with our elective for doing informatics as part of their week.
That is a brilliant idea.
Yeah.
I would love to see what you've done with that.
Yeah.
A major part of our goal is to, make our medical students physician researchers from the moment they step on campus. We want them, asking questions, publishing papers, discussing their own papers with each other from the time they matriculate. We have a system set up currently where researchers or faculty can request data from different sources and execute studies, but it's laborious. It's the barrier to access is very high. They have to have certain credentials that they gain by doing research that enable them to do research. So it's very circular, difficult to break into. And we see the OHDSI framework as this very elegant solution to get around those problems and get people asking questions, generating evidence, and publishing papers very early. So yeah, I think this is the right place. And I'm really encouraged by what you all are saying. I appreciate it very much.
Yeah, I'd like to see the Hopkins syllabus too.
We are actually teaching it in 2 weeks. And so if you want, I can bring in the person who's teaching it. He's one of my, I wanted to be taught by a physician. I feel that that's important. And so he is, and so he could come and talk about his experiences teaching that for the week and from the pluses to minuses. I think Atlas is tough to get people throwing into Atlas with just a couple of hours, but it's all part of the, we'll see the process as it goes.
Is that something that people could audit? Like, could I sit in on a few of those lectures?
You cannot, but the at this stage, so it's interesting. Yeah, we've used Leaf in the past. We're using Atlas now, but it's something that's best to talk to the director. It's we plan an experience for the medical students. A lot of it is actually in person, so I have to go into the office, and so a lot of it is not remotely available.
Sure, understood. Okay, cool. I'd still love to see whatever you can share. That sounds like a wonderful strategy.
We're really happy to share. I think that there's value for this. It would be great to build resources for all medical training programs to help them teach medical students about OHDSI. I have a slightly different opinion. I think physicians who apply to medical school are already researchers. They are so smart getting into medical school. They probably are already a researcher. You just have to keep them from forgetting about that as part of their medical school training. As long as we don't burn them out of being a researcher while they're in medical school, then I think it would be great for having them to continue that as part of their career.
Thank you so much, everyone. Thank you, Chan, for joining us today. Especially, I know it's so late on your time zone. It's close to 1 a.m. So we really appreciate that you took the time to talk to us about your career journey, all the advice, all the tips, all the insights. How can people contact you if they have more questions?
Yeah, you can use forum or you can email me directly. And my email address of OHDSI is seng.chan.you@rdc.org.
Excellent. Thank you.
Yeah, thanks. Bye. Have a great day.
Thank you all
Thanks
so
a
much.
lot.
Have a good night.
All right.
Thank you.